Hello everyone, am I audible and visible? Let me know, then we'll start. Am I audible and visible? Am I audible and visible? Okay, fine. Am I audible properly? Am I audible properly? Okay. Now, let us start. Hello everyone, welcome to Unacademy Future Doctors. I myself Dr. Dipti and I am your faculty for Physiology. Now, let me explain in brief about our subscription. We have two kinds of subscriptions. One that is Plus subscription and second one that is Iconic subscription. Here, in Plus subscription, you can access, choose the best from the best. Here, you can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. Here you can access question bank, which is having more than 25,000 questions. You can compete in the live test as well as quizzes, and with 12 months and above subscription, we will provide you printed notes too. Now, next is the Iconic subscription. Here in Iconic subscription, your access to the best from two of the best, and the two are, one is Unacademy and Prep Ladder. With Unacademy, here you can have all the resources I have already explained, and second one that is Unacademy and Prep Ladder. With Prep Ladder, here you can have clinical and integrated essentials, video lectures from the dream team, question bank 3 with active guidance, system tags, and much more. Just a minute. And you can have question bank 3 with active guidance, system tags, and more, rapid revision and snapshots and treasures and 2021 dream notes. Also, we have added certain features in our special class. We have made the class interactive and live. Here you have facility to raise a hand. You can talk to your educators in the live class. You can poll for the learners here. You can never miss a class as you're always notified for the class. You can download lecture notes, and you can get access to the recorded as well as live session, and you can access your class at anywhere and at any time. Now, next is we also have updated and highly effective question bank, and here in our question bank we have more than 25,000 high yield clinical questions which are based on the latest exam pattern, which includes detailed explanation too. Now, here these are our NEET PG September 2021 toppers. We also have started Focus FMG 2022 test and discussion batch. This was started from 15 December 2021, that is for 6 months, and also we have started Target NEET PG 2022 test and discussion batch from 15 December, and that is for 3 months. Now, so you can subscribe from my from your mobile, and you can use my code DIPTI10 and you can get 10% extra discount. Another, we have also added one more feature. You can get your quick quiz. You can just enter in the quiz. You can see here, you can take a quiz session. So you can enter in the quiz, and you can use the code to join the quiz. Here, code for today's quiz, that is 661409. Okay, so you can resume the code by entering you can resume the quiz by entering this code 661409. Okay, now let us come to today's topic now. Here, just so our today's topic, that is properties of cardiac muscle. We have discussed last time we have discussed in heart we will discuss two types of properties. One, that is electrical properties. These are electrical properties of heart. And second one, these are mechanical properties of heart. So electrical, and second, that is mechanical properties. Okay. Now, so electrical properties are excitability. Okay, excitability is also known as I told you, bathmotropic effect. Okay, then automaticity. Heart has study medico. Hi, hello, welcome to my class. Automaticity, that is conducting system. Rhythmicity, heart generates its own rhythm. This is one of the very important topic for the cardiovascular system. Properties of cardiac muscle. Either it is asked as a full question, okay, or short notes about one of the property. Either excitability, action potential of the heart may be asked, autorhythmicity, or pacemaker potential may be one of the very important question. Automaticity, then conductivity, conducting system, SA node, AV node. Okay, so this also will be asked. Mechanical properties, that is your cardiac cycle, may be asked as a short question. Okay, cardiac cycle. And other properties we will discuss one by one. So today, one of the very important property we are going to discuss, that is automaticity, which is also known as autorhythmicity. What is the meaning of automaticity or autorhythmicity? Heart has a property to generate its own rhythm, own impulse. Suppose if you put the heart outside the body with nutrient supply, with oxygen supply, without any nerve supply, heart has a property to generate its own rhythm, and this is known as automaticity. Okay, heart has its own tissue to generate this rhythm. This is automaticity or autorhythmicity. Okay, so heart has its own pacemaker tissue. This pacemaker tissue initiate rhythm. It initiates repetitive action potentials. Okay, repetitive action potential, and this potential gets conducted, and this is important property of heart. Now, very important thing here is characteristic of pacemaker tissue. Now, what is the pacemaker? What ma'am, first tissue grown in our body, cardiac tissue in mother's womb. These are simultaneous growth. Simultaneous growth of all the, mostly at 4 weeks heartbeat starts. Okay, so that is more about embryology. Simultaneously so many tissues they grow in our at the time of this growth of the baby. Okay, but at 4th week of intrauterine life, heartbeat starts. Yes. Okay, now we come to this pacemaker tissue and its potential. I think all of you are knowing what is pacemaker. In our heart, we have SA node, sinoatrial node, that is our pacemaker. Okay, so now how this sinoatrial SA node is pacemaker, how it is different from other tissues which make it pacemaker. Okay, so now I think all of you are knowing action potential. Okay, so what is this action potential? Here you can see in action potential we have discussed that first is resting membrane potential. Resting membrane potential means in the resting state, negativity, that is inside, positivity outside. This is negative. Resting membrane potential is negativity inside. Okay, when stimulus comes, then there is generation of action potential. Okay, now how this pacemaker's action potential and resting membrane potential is different than other tissue, let us discuss. So here you can see, so this pacemaker tissue, our SA node, it has unstable resting membrane potential. You can see here, this is going towards positive side. Okay, so this membrane potential decreases, or you can say becomes more positive. Okay, and once it reaches to threshold, it starts firing, and this unstable membrane potential is also known as pre-potential. What is the reason, that we will discuss. What is the reason for this pre-potential or pacemaker potential? We will discuss. Okay. Now, next is, so here you can see property of pacemaker tissue, that is pacemaker potential or pre-potential, both are same thing. Okay, and when this pre-potential reaches to threshold, here minus 40 millivolt is threshold, then there is generation of action potential. Okay, so resting membrane potential, you can see other tissues resting membrane potential. Suppose if we are taking about ventricle, their resting membrane potential is around 90 millivolt, but resting membrane potential of SA node is, you can see here, less, negative, minus 55 to minus 60 millivolt. Okay, this is less negative. Okay, now, so what happens here, although it is less negative, so here at this minus 55 to minus 60 millivolt, what happens, our sodium channels, normally for depolarization we have sodium channels, but these sodium channels are inactivated. Okay, so here what happens, which channels they open? Sodium calcium channels, slow sodium calcium channels. Okay, and they result in generation of action potential. You are in class 10, that's good. You can't understand, so but I wish you will be my student in future. Okay, that's good. Okay, so you can see here there is inactivation of fast sodium channel. Okay, and here there is activation of sodium calcium channel. Okay, very good, all the best for your preparation for NEET. Okay, I wish you will be my student. You will be in medical college and you will be my student. Okay, now, so here you can see that is minus 55 to minus 60 millivolt, and here slow sodium calcium channels, they get activated and that generates action potential. Okay, now another important thing here is, as I told you, because of this pacemaker potentials or pre-potentials, you can see there is, once the potential reaches to threshold minus 40 millivolt, you can see there is rapid depolarization and there is generation of action potential. Okay, so this is the unique feature of pacemaker tissue. Okay, now another important thing, what are the ionic bases of this pacemaker potentials, we will discuss. So first thing, suppose here you can see your SA node. Okay, SA node, as we have discussed, resting membrane potential of SA node, that is minus 55 to minus 60 millivolt. Okay, now, so here at this potential there is opening of funny sodium channels. Why are they known as funny sodium channels? Because at this potentials none of the other channels they remain open, only these channels they are open in the pacemaker tissue, and because of that there is slow entry of sodium ions inside. So here you can see, suppose this is your heart tissue. Okay, it is negative inside, but what happens when sodium ions they enter, it starts becoming positive here. Okay, and once the potential reaches slightly above this minus 55 to minus 50, here there is opening of transient calcium channels. You can see here this T type of channels. Okay, so here at this level we have funny sodium channels, they are open, and potassium channels are closed here. Okay, and because of sodium entry, you can see here there is positivity, and once the potential reaches minus 50 millivolt, then there is opening of transient calcium channels, this, and once calcium ions they enter, this potential reaches minus 40 millivolt here. Okay, and when the potential reaches minus 40 millivolt, you can see here threshold. Now here you can see there is number 3, there is opening of long lasting calcium channels. Okay, so now that results in depolarization, as well as sodium channels are also there, sodium and calcium. Okay, so this is not very important, main are our calcium channels. Okay, and that results in rapid depolarization, very important part of pacemaker potential. Okay, and once it reaches to threshold, this will not reach to threshold, this is you can see this will not reach to above the zero potential. Okay, so once it reaches around zero, then there is opening of, you can see, potassium channels. Okay, and as we have discussed, potassium concentration is more inside the cell. So what happens? This potassium ions, they move out. And when potassium positive ions, they move out, what happens? There is decrease in the membrane potential here. Okay, so that is repolarization. Am I clear? So this is the basis of, ionic basis of pacemaker potential, or you can say potential changes in the pacemaker tissue. Okay, I repeat again, you can see here, this is first here when the potential is between minus 55 to minus 60, there is opening of funny sodium channels, and because of entry of sodium ions, potential rises. At about 50 millivolt, there is opening of your transient calcium channels. Okay, and because of opening of transient calcium channels, the potential further rises, reaches to threshold. At threshold, there is opening of long lasting calcium channels as well as sodium channels, and that results in rapid depolarization. Once it reaches, once the depolarization gets completed, then there is opening of potassium channels, and potassium ions, they move out here. Why? Because they are more inside the cell, and when the potassium ions, they move out, there is repolarization. Okay, so these are the changes. Okay, so these are, again you can see all this four. Now next is applied physiology. What is this applied physiology? Whenever this pacemaker, natural pacemaker, as I told you, that is sinoatrial node, when this is destroyed, then what happens? Other tissues also have capacity to become pacemaker. But although SA node impulse generation rate is highest, that is 60 to 80 per minute. So it is our natural pacemaker. Sorry, I'm not getting your ID not showing on Unacademy app. Not getting better. I am in NEET PG. So if you open NEET PG, then only you can get my ID. Okay. I am teaching. I am a teacher in NEET PG, beta. I think you have enrolled for NEET UG. Is it? Okay, fine. When you will be enrolled for NEET PG, you get my ID and all. Okay. So now here. So SA node, when SA node is destroyed, what happens? AV node would be the next pacemaker. If this is destroyed, AV bundle, then bundle branches, okay, and Purkinje fibers. Okay, so this way, destruction of natural pacemaker results in other tissue to be the pacemaker. Okay, now next is, there are certain agents. Either sometimes they stimulate sympathetic or parasympathetic nerves, and this agent, they affect heart rate by changing the slope of this pre-potentials or pacemaker potential. You can see here. Okay, we will discuss how they affect. This is normal rhythm. You can see with the parasympathetic stimulation, as you all know, heart rate decreases and force of contraction also decreases, whereas with sympathetic stimulation, heart rate and force of contraction increases. Okay, now so we'll discuss role of autonomic nervous system in regulation of heart. Okay, so here autonomic nervous system, how do it affects heart? Autonomic nervous system, as we all know, autonomic nervous system has two parts, sympathetic and parasympathetic nervous system. Okay, so parasympathetic and sympathetic. So here parasympathetic, that is our vagus nerve. Okay, so this right vagus nerve, it innervates our SA node. You can see here. Okay, so parasympathetic fibers from right vagus nerve, they innervate supply SA node, and here the neurotransmitter release, that is acetylcholine. Okay, at the parasympathetic nerves. Okay, now here you can see what is the role of parasympathetic. Parasympathetic always decreases heart rate. Okay, and sympathetic increases heart rate. Now there is one terminology maybe asked a short question, vagal tone. Now what is this vagal tone? You can see here, suppose just a minute. Just a minute. You can see here, this is our normal heart rate. This one, this, it is, you can see, slightly higher. It is not normal. This is 100 to 110 beats per minute when vagus nerve is not active. But what is the role of our vagus nerve? When vagus nerve, that is parasympathetic, that brings the heart rate towards normal side. Normal heart rate, that is our normal heart rate, very important thing, sometimes may be asked as a short question, MCQ question also. कोई भी 72 नहीं बोलेगा अगर नॉर्मल हार्ट रेट पूछते हैं तो, हाँ, दैट इज ऑलवेज इन रेंज, बिकॉज हर एक का रोज 72 नहीं रहेगा. सपोज मैं अभी मेजर कर रही हूँ, 5 मिनट के बाद मेजर करूँगी, दैट इज डेफिनेटली डिफरेंट. सो नॉर्मल हार्ट रेट, दैट इज 200 beats per minute. When it is more than 100, that is known as tachycardia. Okay, and when it is less than 60 beats per minute, that is bradycardia. Study medico, NEET UG means you are preparing for MBBS, and NEET PG means you are preparing for MD. Beta, NEET PG for that only. Okay, now so here, that is our vagal tone. Okay, now what is vagal tone? Vagal tone means our vagus nerve tries to bring our heart rate towards normal rather than this high value. Okay, so our heart, our SA node has supply from the vagus nerve. Okay, so this is by the vagus nerve, and this vagus nerve tries to decrease our heart rate. This is vagal tone. Now another important thing, athletes have heart rate less than 60, sometimes less than 60 per minute. Okay, less than 60 per minute. Why? Because athletes, they have higher vagal tone, their vagus nerve is strong, and this is because vagus nerve is strong, the heart rate decreases. Am I clear? Now, so another thing, now how the parasympathetic nerve affects heart rate. You can see here, this is normal condition, resting, and this is parasympathetic. When parasympathetic nerves are stimulated, you can see here, the membrane gets hyperpolarized. Okay, good night, hello beta. So you can see here, the parasympathetic stimulation that results in hyperpolarization of the membrane. Why hyperpolarization? Because it increases permeability of potassium channels. Okay, so when potassium permeability increases, what happens? Potassium ions, they come out of the cell. And when potassium positive ions, they come out of the cell, what happens? The potential becomes negative. So you can see here, when it is hyperpolarized, okay, it takes more time to again depolarize. So you can see heart rate decreases. You can see here, Normal resting condition, there are 4 peaks, 1, 2, 3, 4. Here only 2. You can see 4 beats here, these are 2 beats. So heart rate decreases. Okay, that is one effect of the parasympathetic stimulation. So when parasympathetic system gets stimulated, there is decrease in the heart rate, and that is known as negative, we have discussed, chronotropic effect. Negative chronology, chronotropic effect. Okay, this is negative chronotropic effect of parasympathetic. Negative means decrease. Okay, then second thing is, what is the second effect? Because of parasympathetic stimulation, force of contraction of heart decreases. Force of contraction, so height also decreases. Okay, and force of contraction, that is, you can see, that is decrease in the, or you can say negative inotropic effect. Okay, also there is decreased conductivity. Conductivity decreases means there is negative dromotropic effect. Okay, dromotropic effect. Okay, this one. Next is, what is the effect of sympathetic stimulation? Here sympathetic nerves, you can see here, this is a sympathetic stimulation here. Sympathetic nerves, when they are stimulated, the neurotransmitter release, that is norepinephrine. Okay, that is released. Okay, norepinephrine is released. Okay, and norepinephrine increases permeability for calcium ions. Okay, when calcium ions permeability increases, mainly they open L type of channels. Okay, L type of channels. Okay, and therefore it increases rate of sinus rhythm, and it increases heart rate. Okay, you can see here this one, because you can see here that here there is hyperpolarization, here there is decreased repolarization. Repolarization is reduced, so the potential goes less negative. So it is near the threshold, you can see. When it is near the threshold, you can say that it can easily bring the action potential again. So that is, you can see increase in the heart rate as well as increase conductivity, conduction. So increased conductivity, that is known as positive dromotropic effect. Okay, then next is what happens in the action potential in ventricular muscle fibers. Okay, ventricular muscle fibers, here resting membrane potential is more negative. You can see here minus 85 to minus 90 millivolt. Okay, and here when stimulus comes, then it ascends, it increases. Here there is depolarization. Once it reaches to the spike, then there is, you can see, there is plateau. Why plateau? It is the same thing here also applied because of presence of sodium and calcium channel. These calcium channels are slow to open and they remain open for long period of time. So that is plateau. Okay, and that is followed by repolarization. Okay, so here what is the advantage of plateau in the cardiac muscle? Because of this plateau, this ventricular contraction lasts as much as 15 times than skeletal muscle. Okay, so it is longer than skeletal muscle. So this is the advantage. Okay, and now what are the characteristics of conducting tissue? Conducting tissues, as we have discussed, it includes SA node, your AV node, atrioventricular node, then bundle of his, then bundle branches, left and right bundle branch, and Purkinje fibers. Okay, so these are modified type of cardiac muscle cells. These cells are small and rounded, they have less organelle, they are connected with each other through gap junctions. Okay, and These are pacemaker tissue. All the peculiarities as we have discussed, pacemaker potentials, they are present in this tissue. Okay, they have unstable resting membrane potential. Okay, they have pacemaker potentials or unstable resting membrane potential. Okay, we have already discussed these things. I am not going in detail. You can see at -55 fast sodium channels are inactivated because inactivation gate gets closed. But here there is funny sodium channels, they are open. Then at 50, around 50 millivolt, there is opening of your transient calcium channels. Then long acting calcium channels, they open for depolarization. Then there is opening of potassium channels, and that results in repolarization. Okay, now this is same thing here we have discussed. Rate of production of impulses by different parts of the heart. SA node generates impulse at a rate of 70 to 80 beats per minute. AB node impulse generation rate, that is 40 to 60 beats per minute. Atrial muscle also, that is 40 to 60 beats per minute. 40 to 60 beats per minute. And ventricular muscle, that is 20 to 40 beats per minute. Okay, so this is the rate. And these are the questions. One more thing, I will discuss all these question answers in open house session. So those who are watching me, you can just open the open house session. You can go to the app and just open house session, and you can get answers of all these questions. We will discuss question answers in our open house session. Okay, so thanks for watching my class. If you like my video, you can like it, you can share with all your friends, and you can subscribe our channel Unacademy Future Doctors. Thank you.